Good afternoon, and thank you very much for inviting me here to speak to you today. Normally I would begin by setting out the dismal state the health service is in after 14 years of Conservative neglect, and by now I can recite it in my sleep. The longest waiting list, lowest patient satisfaction, and the worst strikes in the history of the NHS. I think you already know all of that, and today I want to talk instead about how the NHS can change and what the NHS can become. In December last year, I visited Singapore General Hospital, regarded as one of the best in the world. Patients arrive having already registered their appointments via an app. They check in on touchscreen kiosks, awaiting them at reception. Each patient is provided with a printout of their day, probably the only analogue bit of their experience, the times and locations of their appointments, tests and scans. A personalised itinerary that makes best use of patients' time. Tablets at their bedside allow patients to read about their treatment, request refreshments, or call for assistance if they're in pain, treating patients with respect, keeping them informed, and making efficient use of staff time. Behind the scenes, robots collect drugs for prescriptions, deliver medicines, and wash equipment. I realise, given what many of you are used to, this won't exactly sound like revolutionary technology, but this is space-age stuff compared with where the NHS is today. On a visit to Alder Hey Children's Hospital in Liverpool with Keir Starmer in January, we spoke to the parents of 2-year-old Elliot. In his short life, he has already had 5 operations on his heart. His parents have been through hell, but the frustration they feel and wanted to talk to us about wasn't what we were expecting. It was about technology. Their local hospital can't access the notes from Alder Hey, and Alder Hey can't read the records held by their GP. It means every appointment they have to repeat themselves again and again. The health service should be lessening their worry, not adding to their stress. For the past 14 years, modernisation of the NHS has been put on the back burner by a Conservative government which opts for sticking plasters instead of the major surgery that's required. As a result, the service still runs on outdated 1980s technology. When I visit hospitals, doctors often get out their pagers to show me what they're forced to work with. Unleashing the power of technology is not abstract. This is about how many patients the NHS can treat, how long they have to wait. It's also about our experience as patients, how we're kept informed, how our time is respected. An estimated 13.5 million hours of doctors' time is wasted every year due to inefficient IT. Fixing that would be the equivalent of 8,000 new doctors joining the NHS. That's the difference between the huge staff shortages in the NHS and filling almost every vacancy for a doctor. With our country's population ageing, the health of the public worsening, and chronic disease rising, this is also about the sustainability of the NHS, whether it can survive the coming decade. The budget for health was 42% of departmental spending this year. Because the Conservatives crashed the economy, there isn't scope for it to go much higher. So there is no future for the NHS that involves continuing with an outdated, inefficient, and costly way of working while demands on the service rise and costs pile up. The NHS is at a fork in the road. Another 5 years of the Conservatives and it could go the way of Woolworths, a much-loved national institution which failed to change with the times and was left behind. That is the path it is on today, but it's not inevitable. The NHS can change, and the staff working in it are crying out for change. The health service we've had for 75 years can be there for us for the next 75 years too, because the NHS has so much going for it. Following the pandemic, 31 million people in England carry the NHS app in their pockets. It has the potential to transform how the NHS interacts with patients, people's control over their own healthcare, and the ability to promote better public health. We need to see the NHS app not just assisting the NHS in healthcare, but becoming a key component in delivering care. Technology is changing what care is. The ministers I spoke to in Singapore and Australia before Christmas envy the NHS, not for the state it's in today, but for the advantages it has as they look ahead to the age of genomics, predictive medicine, and big data. And it's true. I went to the National Theatre last week to see Michael Sheen in Nye. Nye Bevan had no idea when he created the NHS in 1948 that any of this was coming. Yet the values the NHS was built upon, universal healthcare, publicly funded, free at the point of use, are not only as relevant and necessary today as they were then, but the single-payer, universal service also makes the NHS best place to take advantage of the scientific revolution unfolding before our eyes. The problem is, if you drop Nye Bevan into an NHS hospital today, he would recognise far too much of it. When I look at healthcare around the world, the problems with our system become obvious. The NHS gets to patients too late. It's a hospital-based system geared towards late diagnosis and treatment, delivering poorer outcomes at greater cost. An analogue system in a digital age, a sickness service, not a health service, with too many lives hampered by preventable illness and too many lives lost to the biggest killers. Key to turning this around is to bring the NHS out of the analogue age and into the digital age. It will take a decade of change and modernisation, but a reformed NHS, equipped with the latest technology, is fundamental to catching illness earlier and preventing it altogether. In short, the choice facing the NHS is this: to modernise or die. There are innovations happening right now which will change the face of healthcare, are changing the face of healthcare. They offer a lifeline to the NHS that it can't afford to miss. Tools can map radiation therapy onto cancer cells, avoiding organs more precisely than an oncologist working alone. And it does it in seconds rather than the hour it takes a doctor. AI can help interpret chest x-rays, saving 15% of a radiologist's workload. When combined with interpretation by a consultant, it cuts half of missed lung cancer cases. New AI-enabled scanners can identify lung damage in patients who have recovered from COVID-19, missed by regular CT scans, a game-changing breakthrough in the treatment of thousands of Brits living with long COVID. All of that is available today, but step into an NHS hospital and the chances are you won't find any of it. Labour will arm the NHS with the modern technology it needs. We will double the number of scanners, putting AI into every NHS hospital so patients are diagnosed earlier. At the moment, innovators have to tout their technology to each individual NHS trust, signing separate agreements with each of them. It's an unnecessary bureaucratic block to change. We will get rid of it. Instead, Labour will streamline the route in for innovators. So if you're selling what the NHS needs, we'll hold the door open and push you through it. More than that, the NHS won't just be a better customer for the tech sector, but a great partner. I arrived here this afternoon straight from Moorfields Eye Hospital. In 2016, Moorfields and DeepMind launched a partnership that allowed the tech company to analyse thousands of anonymised patients' data. In fact, I understand Wired was key to bringing that partnership together. So it'd be interesting to see what partnerships you form today. In just 2 years, they developed AI that reads scans just as accurately as a doctor. Now just imagine what might be achieved if the entire NHS had that same partnership with our technology and life sciences sector. The NHS at the forefront of developing new medical technology and medicine to save countless lives, putting NHS patients to the front of the queue and securing the financial future of our health service through deals and partnerships that offer value for money and a good return on taxpayer-funded research and innovation. Clinical trials can use genomics to identify patients who will benefit from the latest treatments, but they struggle to recruit, not for a lack of people willing to take part, but because they can't access basic data. Labour will cut red tapes so that clinical trials can easily and rapidly recruit NHS patients, with the app inviting the most relevant, eligible and therefore willing people to take part. Because the British people showed during the pandemic that they want to help fight disease. 500,000 signed up to the vaccine trials registry. If we could do it to defeat COVID, we can do it to cure cancer. The Australian healthcare system partnered with Telstra to do cervical cancer screening programs 8 years ago. They're now on track to be the first country in the world to eliminate cervical cancer. Thousands of lives transformed thanks to that partnership. If we get the NHS working hand in glove with our leading life sciences and technology sectors, then next time, Britain will get there first. That's what Keir Starmer's mission-driven government will be about. Because this is not only about curing major diseases or creating new equipment, exciting as both of those things are, it's about making patients' lives easier, healthier, and in their own hands. When I attended a MedTech conference in Israel 2 years ago, I showed some entrepreneurs the NHS app on my phone. They burst out laughing, which wounded my national pride and patriotism. Like so much of the legacy of the pandemic, this innovation has been left to grow fallow. Just 1 in every 200 GP appointments are booked through the app. In 2024, patients still wait on the phone at 8 a.m. in too many cases, or even queue up in person in the cold on a frosty morning just to see a doctor. It's no wonder so many people don't bother or don't have time. Illness is caught too late, pressures on the NHS pile up, and lives are lost. We've been using banking apps for a decade now. Running important aspects of our lives through an app has become normal. We can have our bank account in our own hands. We now need our NHS in our own hands too. Just as we can for every other aspect of our lives, all patients should be able to interact with the NHS through the app. I want the app to put patients in charge of their own healthcare. Today, when the wealthy, well-connected receive a diagnosis, they know what to expect, who to chase, and how to push for the best care. But most working people, especially those from backgrounds like mine, do not, and so they miss out. Labour will give power to the patient. When you receive a diagnosis, you'll be told what care to expect and by when. You'll be able to see which GP practices near you provide the best care for your condition, so you can switch if you want to. You'll be able to refer yourself direct to specialists where appropriate, so you don't have to wait a month for a pointless GP appointment, and GP's time isn't wasted on box ticking. The app shouldn't just be for health care, but healthier living too. The earlier we catch illness, the better it is for patients and the less expensive it is for taxpayers. When you reach the right age, you'll receive notifications for jabs, tests and screening to catch diseases like breast and bowel cancer early. Many of our phones count the steps we walk every day. No one in the NHS knows that information. The Singaporean government is providing and promoting healthy living through its Healthy 365 app, a national step challenge encouraging hundreds of thousands of Singaporeans to walk 10,000 steps a day. It's a government taking the power of technology to send a serious public health message. Politicians should always seek to tread lightly on our lives, whilst empowering and helping each of us in simple ways to lead healthier, happier, better lives. All of this is possible right now. And if you ask patients whether the NHS should be able to access their medical information at the point they walk through the door of a hospital, an A&E or a GP practice, most would be surprised that it's not already the case. The rest would know through bitter experience that it is not. It would be far better for patients, save countless hours of staff time, and it's key to a more ambitious NHS, yet it's still not been done. Why? Because reform is hard. You come up against vested interests who resist change, and against a system that's called the National Health Service, but it's really thousands of different organisations. The easy route for governments with an eye on the next election is to simply promise more funding, more staff, more buildings, but duck the long, hard task of reform. For the Conservatives, the NHS is covered in warning signs, flashing red with big bold letters spelling danger, do not touch. They know they aren't trusted with it, so they daren't change it. Whereas I think Labour feels a special responsibility to the NHS, not just to be its watchman, but to live up to its founding promise, that it must always be changing, improving. It's why I think that just as only Nixon could go to China, only Labour can reform the NHS. I'll give you an example. The last Labour government introduced patient choice in 2002. It was deeply unpopular with sections of the NHS who said patients didn't have the information to make a choice, or didn't even want the choice. But we made the case for it, took on the conspiracy theories that this was about privatisation, and won the argument. Now it is a widely held principle that it shouldn't just be the rich who can choose to jump the queue or change provider, that the NHS should pay for any patient to choose to go to a different healthcare provider if they can offer faster and high quality care. We will take the same approach to the major issue for the future of the NHS, patient data. The NHS has struck gold here, yet it's leaving it in the ground. It's setting up a federated data platform, which is absolutely the right thing to do. But the government had a choice. They could face down the conspiracy theorists on one hand and the vested interests on the other, or they could back away and leave the job half finished. The timid Tories chose an easy life, and we're lumbered with a worst health service. The platform doesn't include general practice data, which is key to unlocking better population health outcomes and where most of patient contacts take place. And many hospital trusts haven't even signed up to it yet. And while the tinfoil hat brigade take to TikTok to urge followers to opt out of sharing their data with the NHS, and the irony of people being on TikTok making these complaints or being on Elon Musk's platform atting me in my mentions is not lost on me, the government refuses to take on their fear-mongering. It's a fight that a Labour government is willing to have. That data doesn't belong to GPs or hospitals, doesn't even belong to the NHS or the government. It belongs to patients. It is our data, and patients trust the NHS with it. I want a much bigger role for GPs as we turn the NHS on its head and make it not just a national health service, but a neighbourhood health service with much more care delivered closer to people's home. They are key to fixing the front door to the NHS. But the quid pro quo must be that data is shared across the NHS. It is mission critical to better care for patients, better value for taxpayers' money, and better medicines and technology for the future too. As Health Secretary, I would put patients' voice at the centre of decision-making about the use of data in the NHS. We will be transparent about which aspects of patient data are shared, which third-party organisations will have access, what patients' rights and the mechanisms to opt out are, and the safeguards that are in place to protect patients' confidentiality. Under the stewardship of a Labour government, data will play a central role in our mission to make the NHS fit for the future. Because if these opportunities aren't taken, the service will be left to wither on the vine. The NHS might fail to secure the advantages of AI and new medicines for its patients, but private healthcare won't. The two-tier system that is emerging in our country today will grow. The gap between public and private widen, and the NHS will become a poor service for poor people. And that's the future we've got to avoid. We have an incredible life sciences and medtech base in this country. A Labour government is determined to work in partnership with you so that the NHS can secure the benefits of the technological revolution for the many, not just the privileged few. The prize for modernisation is huge. Shorter waiting times, higher patient satisfaction, fewer lives lost to the biggest killers. An NHS there for you when you need it for the next 75 years, just as it's been for the last 75 years. That is what a modern NHS can achieve. It will be the mission of Keir Starmer's Labour government to deliver it if people vote for it at the general election, when it eventually comes. Thank you very much for having me along.